Homeopathic medicines for tendency towards recurrent or habitual abortion, threatened abortion. Sepia Succus, one of the most reliable homeopathic medicines for tendency towards recurrent or habitual abortion arising in the 6th or 7th month. Sepia Succus is a well-indicated homeopathic medicine for treating the tendency towards repeated abortion occurring at 6 or 7 months. Abortion in the 6th or 7th month with bearing down pain in the uterus is a prominent symptom that decides on Sepia Succus as the best medicine. In a few cases, griping or burning pain in the uterus may be observed. Case study will reveal irregular menses, yellow or green leucorrhea and uterine fibroids. Ferrum Metallicum, homeopathic medicine for tendency towards recurrent/habitual abortion at the end of 8th month. Ferrum Met is very useful among homeopathic medicines for tendency towards recurrent/habitual abortion occurring at the end of the 8th month. Women who need Ferrum Met will have a history of previous abortions with pale blood and shooting or labor-like pain in the uterus. Profound weakness and anaemia may also be observed among women who need Ferrum Metallicum. Ferrum Met and Trillium pendulum, top homeopathic medicines for tendency towards recurrent or habitual abortion in anemic women. Anemic women having a tendency towards repeated abortion will benefit greatly from homeopathic medicines Ferrum Met and Trillium pendulum. Ferrum Met is useful where women have had many miscarriages with pale and watery bleeding. This is attended with labor-like pains in abdomen and small of the back. Trillium pendulum is the most effective among homeopathic medicines for tendency towards recurrent or habitual abortion in anemic women who have had early miscarriages with gushing bright blood. The bleeding worsens with the slightest movement. The bleeding is attended with pain in the hips and back. Arnica montana, Erigeron, Crocus sativus, Sabina officinalis, significant homeopathic medicines for treating threatened abortion. Arnica montana is one of the well-indicated homeopathic medicines for treating threatened abortion from trauma, falls or injuries. Erigeron is considered when there is threatened abortion from exertion. Crocus sativus will best treat threatened abortion with dark and stringy blood. Sabina officinalis shows best results in case of threatened abortion with marked pain from sacrum to pubis.